Hello, dear colleagues. My name is Mynzhylky Berdikhojayev. I'm here together with my colleague and assistant Rawan Maratlu, ITLE. We are from Presidential National Hospital in Almaty. The full name of the hospital is too complicated, that's why it's just a Presidential National Hospital. Almaty City, Kazakhstan. Kazakhstan located in Central Asian region. And today is 5th of February, Thursday. And this is a case number 1. We started 30 minutes ago. The anesthesia general and with all these activities. And now we have patient number 1. Просто Y коннектор будет. Екіншісіне обычный Y коннектор бересіңізші без хвостика. Yes, patient number 1. Жыртылмаған ғой, да? Жыртылмаған ғой. Yes, patient with incidental finding because of headaches, as usual. 90 градусов тұру керек. Подожди. Я 90 градусов тұрсын. With headaches, as usual, patients going to the MR and doing MR and then MR angiography. And on MR angiography in this patient, the MCA aneurysm, the most bigger one, was diagnosed, and also we saw this small aneurysm on the ACOM. It's nearly 3 millimeter, and the MCA aneurysm is nearly 5 millimeter. And this aneurysm, because of the irregular shape and location, and because of more than one aneurysm, давление сварой, да? Yes, and patient is hypertensive. И аелькасы, да? Hypertensive female. That's why we recommended operation or endovascular procedure, which definition is more close to your practice. And Rawan Maratlu, ITLE, Rawan made a 3D angiography. I will show you in a couple of minutes, in a couple of moments. Yes, it's clearly visible 2 aneurysms. One is small on ACOM territory, which is the small, but the shape is ugly. And usually the ACOM aneurysm is more likely to be ruptured. Contrast here, Madina. That's why in our country, if we see aneurysms, yes, there is different practices. The European-like practice, but we are not in Europe, and this is simple Asian country, and the genetic of the Kazakh population is close to the Japanese. That's why if patient has an aneurysm, we usually recommend surgery, like in Japan, even it's unruptured one. Так, немато қоспай салу керек ішіне. Иә, 15 миллилитр. Ладно, керек жоқ. Okay. There is no name of the pin. It's a problem, it's just the beginning of the year, but the year is not begun, not begin. And as usual, it's a problem. Because of tender system, because of the governmental medicine, and yes, with United States yesterday in news we have seen the shocking news that 2 Kazakh students created fake company, medical company, and delivered on paper for $1.5 billion the medical devices for nobody, for the fake patients. Yes, in Kazakhstan we have experience of delivering insurance. Now there is a big trouble of the insurance system, and before 2026 insurance system was under Ministry of Healthcare, and because of the big scandal it was more than 700,000 mom screening for uterine in males done and 15,000 died Kazakh citizens received medical service. That's why thanks to the digital technologies in the USA, you found the fake guys on time, but in Kazakhstan it's a problem. Okay, let's focus on the case. This is a aneurysmal case, and let's place it in the projection. I think it's something like this. The aneurysm shape is like this. And I hope you agree this aneurysm should be treated. And this is bifurcation aneurysm on MCA. It's also the indication for the treatment. I hope you agree with me. And this is a working projection. Right 13, caudal 37. We'll place it like this. Yes, and for the procedure like this, we prefer to do it under general because of the if I will place for these arteries flow diverter stents, then it's no problem. But if we plan to do intrasaccular treatment, then I prefer to do in a 3 mm aneurysm. It's anesthesia general. Okay, general anesthesia. Okay, yesterday I visited Kazlarda city, which is 1,000 kilometers from Astana and nearly 1,000 kilometers from Almaty, and together with my colleague Nardinov Khanat, he is a neurosurgeon, we treated 5 patients together, and another 1 patient was treated by Khanat. Khanat treated ophthalmic aneurysm, and he asked me to assist for ruptured. It was a pike aneurysm ruptured in young gentleman, just 32 years old, and then it was a lady, a famous lady from the region, She were under control of the Ministry of Healthcare, and also we did the carotid stenting with vertebral artery stenting, and the second lady was bilateral carotid origin stenosis with the left vertebral artery V1 with the beginning of the V2 segment, approximately 10 centimeter occlusion. In my practice, for the chronic occlusion, it was the case number 2 or 3, and it was successful. I will ask Kanat to share the images. And at night I traveled to Astana, and early morning, and early morning I had a flight to Almaty. Yes, it's as usual practice. Huh? And tomorrow, with the Medicover company, we have cases in Tashkent. There is an ICAT, and there is a patient with the okay, let's measure. I hope we can finish without stenting. Because of 2 aneurysms, I don't want to place stent. I want to coil both aneurysms, and we can follow if the aneurysm will start recanalizing, then we can place additional stent in delayed manner in step treatment 4.9. But the MCA more looks like for the stent assistant, and the ACA could be coiled with balloon assistance. Okay, let's see the MCA. MCA looks like this. It's quite okay, but let's see. I think the projection is underlying on the M1 segment. It's like this, and then again. Okay. Okay, let's check. And now we will start from ACOM. Okay. Yes, because of the wide neck, I think there is no problem which AC will be catheterized. Okay. There is a small branch, and the balloon is stuck at the orifice of small branch. And this is a Eclipse single lumen, which is a little bit stiffer than Eclipse double lumen. Okay, let's go to this branch. It's left AC. It's an Eclipse single lumen. It comes in the box with the hybrid 1214. Yes, and Eclipse single lumen also could be combined with the... it's too stiff, huh? The balloon is quite stiff. Yes, it could be combined with the Traxxas. Traxxas is more flexible one. That's why time to time I prefer to combine the eclipse single lumen with the traxes. The contrast part of the wire is quite soft. That's why for the navigation of the micro, better to place the non-contrast part of the wire. It's better. Okay, that's better. Okay, we can see the aneurysm on both projections. And today on the shelf we have only gamma 17 and headway duo. Gamma 17 is a little bit stiff and headway duo is a little bit soft. That's why it might be a little bit complex during the catheterization. Yes, the aneurysm is mostly looked down. I think it's a branch. I think we need to change the angiography. After placing the balloon, everything was changed. Okay, let's replace the rod mount. Stop. Yes, aneurysm is located up. It's behind the ACA. That's why there is some confusion. Okay, now we are inside the aneurysm. It was looked like inside. Yes, because of the shipping, the device is following the first implanted device. That's why it's behaving like this. Okay, let's go first there. Yes, it's quite stiff device and even we made a 90-degree angulation. It's all the time looking forward. Even we made a 90-degree angulation. Okay, now I'm trying to rotate, but gamma is quite stiff to rotation. Okay. It's quite stiff. It's not the ideal microcatheter. Okay. Yes, for this kind of aneurysm it's better to have a something like pigtail. Down. But the aneurysm is looking up. On lateral, it looks like we are inside the. That's a step. As in some cases, maybe the strategy of flow diverter placement is okay. Yeah? Just place the flow diverter without. I think we lost the shape on microwire. Yes, now we're inside. Yes, it's not so pretty aneurysm. Okay. We can use the Domkrat lifter. I don't know how in English will be the device using to lift the. No. It's AC. It's not the headway, it's not the echelon, it's a gamma. It's a stiff device. There is angulation. That's why it behaves like this. I hope it's inside, but it's facing the anterior wall of the aneurysm. Okay. The 3 mm could be too much. Екіде 8 бере салшы. Даже екіде 6. Екіде 6. Yes, it's a complex soft Optima. The microplex we will use for the MCA aneurysm. But for this aneurysm I need something predictable. The last several coils, 3 or 4 coils was not detached, which were the microplex. Yes, for some reason, just FD placement because of the nice ACOM could be okay. Екіде 4 дайнап қоясаңыз. Yes, and it's facing the aneurysmal wall. Okay, let's see how it will behave. Can a little bit soften the microcatheter to prevent the possible rupture. That's okay. I think it's okay. Отделять. Так, и где торт-7? Может, бержарный торт? Бержарный торт. Любой бержарный торт присутствует. The next coil we asked for a little bit smaller. 1.5 by 4. Yes, if you have a headway, then it's possible to do 90 degree, and the headway is keeping the 90 degree. With the echelon, you should do a little bit more than 90 degree, and with gamma you should do pigtail to have a 90 degree. Rowan made it 90 degree, but it was 30 degree, not the end. Because of the material of the microcatheter, it's a little bit stiffer, and it was designed especially for the stent delivery. And nowadays we are using it for the coiling. But the microchap is also for the stent delivery. I hope there is no pressure. It looks like it's enough, huh? And now catheter is outside. Okay, let's check. Yes, and all the time we need to cross the finger. I have seen one of the presentations from the colleagues. What is important when you place the braided stents, yes? Сондай презентация жасап қойыпты. There is a 10 important points when you deliver the braided stent. Не отделилось. It's not detached. Yes, it was a criteria. Number 10. You should have luck. Удачи. To deliver the braided stent, you should do the first, second, the third, the fourth, the 10th, and the point number 10, the physician should have a luck, which is very important. Huh? Okay. Now we detached, and I hope it's inside the. Yes, you should be a little bit lucky. It should be a little bit luck when you deal with the peoples. Okay, let's check. I think the half millimeter is here, is open, and there is no another aneurysm. There is a fenestration. It's okay. It's a trifurcation, eh? Trifurcation, not the bifurcation, it's a trifurcation. Okay, let's take it out. We will do a little bit more angulation because the MCA is nearly the same. It's a 90 degree angulation from the bifurcation. You can see here, like the icon. Now we will give 3000 units of heparin. Heparin bilsiniz şunun. The coil tail look like touching the write ACA, but usually it's not a problem. Patient pre-medicated and tested, and the medication is effective. Okay. Now we are inside the aneurysm. On the lateral, we can see we are inside the aneurysm. Okay, let's stay like this. And we can take out the balloon. After taking out the balloon, everything is changing. With the balloon, we should go for one of the branches. The lower branch or upper branch. Let's see which branch is. This is most important, yeah? Because this one is parietal lobe and temporal lobe, but this one is motor cortex. And let's look like this. No? 113. Let's look like this. And something like this, and I think the upper branch is most involved. Now I will try to go to the upper branch. So it's the lower branch. It's inside the aneurysm. Just to the lower branch all the time. Okay, now we are in the upper branch. Yes, I can do it because I have experience, but if you're beginner, it's better to find the working projection. I can orient on the lateral view. I have 3D in my head, that's why I can do this navigation. But if you are just beginner, then it's better to go for the working projection, to prevent the complication. Okay, it's something like, I think it's something like this. 46 by 15 triangle. Yes, and then next week, Monday, I'm planning to visit Dubai for the Arab Health. Okay, the lateral will leave 0, and the AP, the lateral will go like on the image, 46 by 15. Yes, Dubai for Arab Health, it's an exhibition. Okay, 3D roadmap is like this. Let's try to do it something like this. Then it's more this. Okay, maybe like this, but then there is a lot of branches in between. Okay, let's leave it like this. Yes, and now I will try to show you on the AP and lateral how the instrument is behaving. Yeah? AP, yes, AP is also could be used for the live navigation. Stop. As we can see where we are, and lateral is more informative. Stop. Okay, I will measure. Yesterday I realized that the colleagues for some reason don't really understand the difference between devices, and also we are doing video recording, but in many most of the moments it could be not so not so useful. It's nearly 3. This is nearly 4.5. We can take 5, or we can take 4 by something. Okay, let's see. Microplex пересаш, космос. Бес он бес. Бес он бес берес, сосын нан берес. Жасылды, okay. Okay, I am asking Madina. Madina is the operating nurse. Жанна is anesthesiology nurse. Nazım is Arzagul, right? Arzagul is second nurse in the operating room, and the video company today presented by Roman Polish. And anesthesiologist, and we have anesthesiologist in the room. The colic anesthesiologist. Okay. This is a coiling catheter inside the aneurysm. Okay, now we're near the neck. I will take it back a little bit. Okay, just a second. It goes directly. I think it's ideal aneurysm for RTs, web, Luna, contour, any kind of intrasaccular. Rowan. It's possible to place any kind of saccular for this aneurysm. It's ideal. Unfortunately, for this case, we have no intrasaccular. We should do it like 40 years ago. 40 years ago it was done by coils, and 30 years ago it was done by the balloon assistants, thanks to Professor Moray, and thanks to Shimon Maimon. He is my teacher, and thanks to Rene I have seen the variation of single balloon, double balloon, triple balloon. Yes. Thanks, Rene. Okay, now the microcatheter is outside of the aneurysm, and it's look like it's not so mobile because of the inflated balloon. Okay, let's try to place. It's just a simple coiling. Okay, now we are inside the aneurysm. As the coil is 5 by 15, that's why it could be a little bit stiff. And with one coil we could fill the whole aneurysm, but it might be a little bit risky. Okay. Okay. It's not detached. Too many surprises with the microplex coils. Okay. There's a animal. Let's try to do it again. Еще раз. Okay. Let's check it. Yes, now it's detached. Experience. We have only one very French coil. Very French coil is VFC coil. Versatile. There is a name. Versatile something. Spirale deembolization in the Oscar. Okay, VFC. VFC coil 36 by 10. I hope it will go. It could be 6 mm, it could be 3 mm. It's a very French design, very Kazakh design also. Kazakh people also very flexible. We can do 3, we can do 6. Okay. I think the Spanish people, Latin American also very flexible. Indian also. Indian people also. I hope you can understand my humor. Okay. And you have the same level of sense of humor, huh? Okay, let's put the split mask. And now there is no so many places to place the coil, and it could be a little bit tension inside the aneurysm. It's going. I hope it was aneurysm there. Okay, there is still place for 2 mm coil. Икде alta. Microplex. Yes, it's like a trial. Yes, for the ACOM we placed Optima coils, and for the MCA we placed Microplex coils, and then we can see which one will be with stable occlusion. Okay. With the same operator, with the same cut lab. It's just for control to be sure that everything is okay and coil is detached. Microplex. It's a trial, eh? Real life trial. Okay. As the coil, the balloon is mostly for the security. Yes, it was a very interesting experience from the Professor Michel Piatan and his team in Paris. The initial experience with the Artis device from Medtronic, which was now it's I think it's a Luna Artis. Yes, and it was spherical single layer, and when you combine the Luna device with the stent, in his experience, when he combined the Luna with the stenting, it was 100% of occlusion. But in the cases without stent assistance, it was 100% of recanalization. I think there is a place for I think it might be enough, but we will try. Okay, let's do control angiography. Yes, it was the experience from Professor Piatan And for the coils, you can place any kind of coil, and if you combine it with the stent, then the occlusion rate is higher. Yeah? If you place only coils, then the occlusion rate might be less. I think it's enough, huh? I think it's enough. The next coil will be extra, as usual. It will go outside, and it might be reason for the complications. Okay, let's just take it out. Бүгінге аневризм бар ма тағы да? Жаңа біреу звондады ғой, Mynzhylky салашы, менде аневризма деп. Айыл кісі. Okay. Okay. We have 4 cases for stenosis. If it's interesting, we will continue. I think it's interesting. I will try to explain the protection devices. Also the yes, yesterday I noticed some gaps in explanation. I will try to fill the gap. That's why we will continue wasting. Sorry. Sorry. Okay. It's quite stiff balloon, huh? You saw how the MCA anatomy is changed after the taking out the eclipse. Eclipse is like a Vasco. Vasco is quite stiff microcatheter, and Gamma is stiff. The soft catheters is Magic and Sonic, the other catheters. And I have seen the possibilities of rotor. It's a new microcatheter in India. It's available only in India, and Balt India is the only owner of this catheter. And for me, the rotor 21, it's like Headway 21. It's quite nice catheter, and it's quite soft, and it's compatible with the stents. Rotor 21, rotor 17. I think there is 27 also, but I have seen 17 and 21. It's very nice catheter. And I asked the Vivek. He said the rotor is available nowadays only in India. I hope it will be available soon in Kazakhstan also, and in the rest part of the world. Okay. Okay, now we will do expert CT. I hope you agree with the result, and the result is acceptable. This is a control. ACOM aneurysm is occluded. MCA occluded. I think this is infundibulum or just beginning of the aneurysm. Maybe in the future we need to place something here. We can start from the right ACA and finish here. We will see. We will closely follow this patient. It might be aneurysm number 3. It's a microaneurysm. Okay. Yes, I'm talking with Rawan in English. He visited Fujita Bantan in Japan, and I hope he can understand English. Yeah. Okay, he understands. Yeah. Okay, this is a microaneurysm on bifurcation. Okay, let's check. Let's check. We have a 3D before changing for, or it might be. Okay, let's do NPR. This is coronal. Okay, let's check like this. It might be infundibulum. Yes, it might be infundibulum. Okay, infundibulum. We will follow that segment. Okay, let's wait for expert CT. Okay, dear colleagues, the CT is ready, and you can see the coils on ACA, MCA, and the brain is clear. Review можно будет, Ром. Okay, and let's check again the ACA territory. ACA is clear. Review, да? Ага. Нету? Окей. Роман, не, малко слышишь, като аз это слушаю. Okay. Now you can see the review. The coil tail, it's a little bit in the ACA, but it's not a problem. It's in the pericallosal. Yes, it's pericallosal, right? But it's okay. It's clear. We'll keep the dual antiplatelet and we'll give for a couple of days anticoagulation. And now we can finish the case. See you next 30 minutes. Next case is ICA or vertebral artery stenosis. See you.